With horizontal chop techniques, the nucleus is divided into two fragments using a chopper moving in the horizontal plane. After being placed at the lens equator under the anterior capsule, the chopper moves toward the tip, which has been impaled in the center of the nucleus. When the chopper reaches the tip, both instruments are moved apart, leading to mechanical division of the nucleus. But some of the patients are not fit for horizontal phaco chop. For these patients we use a hybrid technique called the stop and chop. In this video, we would like to discuss stop and chop during phaco cataract surgery. You can find the links to other videos on similar topics in the description of this video. You can also find the links to the instruments used in these steps in the description of the video. The stop and chop is a hybrid technique that begins with sculpting, followed by chopping. A groove is sculpted across the nucleus, which is divided into halves by pushing the chopper and the tip apart, as in the standard divide and conquer technique. After that, each half is further divided using chopping. There are two advantages to this hybrid technique. First, the groove creates a space that facilitates surgical manipulation of fragments during emulsification. With techniques using chop exclusively, once the nucleus has been divided, fragments fill in the capsular bag like a puzzle, making it difficult to take them out of the bag during emulsification. Second, the technique skips the first chop, which is more difficult to perform, and thus this technique may be suitable for beginners. Hope you find the video useful. Please let us know in the comments the factors which you think are also important for stop and chop. Please let us know the other topics on which you would like to see similar videos. Check the description below for a link to other useful videos and instruments mentioned in the video.